Hi, I'm Dr. Ben Kleifgen. I'm a pediatrician here at Washington Pediatrics, and I wanted to talk about the COVID vaccine for 12 to 15-year-olds. I got my vaccine as soon as I could. I was really excited to get it. I felt so relieved, like a weight had been lifted off my shoulders. I wasn't afraid of getting sick. I wasn't afraid of passing it on to my family or of passing it on to the patients I see and their families. It was also really moving to be a part of something so big and so historic. The pandemic was horrible, obviously, but the scientific community coming together to develop this vaccine was really a momentous occasion, and it's really amazing to be able to be a part of that. After my vaccine, the first vaccine, I really didn't have any reaction. After the second one, I had a little bit of a sore arm. The next day I was kind of dragging, didn't feel 100% myself, but I still came to work. I don't think you would have noticed if you saw me. I was just feeling a little under the weather, and it lasted about a day. That was about it. Most of the people I've talked to who have had a reaction, that's about what they're dealing with. My wife and I are both fully vaccinated. All the adults in our immediate family are vaccinated. My children, I have 2 daughters. They're too young to get the vaccine now, but as soon as the studies show that the vaccine is safe and effective in younger children, we're going to take them to get vaccinated. And they're actually sort of excited about it, although they don't like the idea of the shot. So I absolutely recommend getting the COVID-19 vaccine for everyone who's eligible, and especially for 12 to 15-year-olds who have just recently become eligible. It's going to help decrease the chance that they will get sick. While it is true that kids that age don't tend to get very sick with COVID, they can. It's caused about 13,000 hospitalizations in the US. And COVID-19 is actually one of the top 10 causes of death for children or anyone under 18 years of age in the United States. There have been about 300 kids who have died of it. So it's still a serious illness. And I think that it's important to remember, if this weren't in the context of a global pandemic, this would be a really big deal. We'd all be justifiably very concerned about a disease that came out of nowhere and caused this much illness among kids and teens. The second reason teenagers should get the COVID vaccine is because they'll prevent them from transmitting it to their families. And even if they don't get very sick, they could give it to an elderly relative who would be at higher risk for really severe illness. And the third reason to get it is to get back to normal life, that we can get back to stopping worrying about 6 feet, we can take off the masks, still wear them in our office because it's a healthcare setting, it's a little bit different, but we can kind of relax and go back to the way things used to be and the great before. I think it's also important to remember that if you have the vaccine and you're exposed to someone who had COVID-19, you don't have to quarantine and you don't have to get tested if you don't have symptoms. That's not true if you haven't been vaccinated. It's also important to note that colleges are starting to require a vaccine to attend. At my last count, there were about 30 colleges in Pennsylvania and dozens to maybe hundreds in the United States. There's a very long list. So this vaccine, specifically the Pfizer vaccine, is incredibly safe and incredibly effective. In the studies in this age group, it was 100% effective. They had 1,000 kids who received the vaccine and none of them got COVID in the test. And that tracks with the millions of doses that have been given in the country. It reduces the risk that you're going to get sick by an incredible amount. And the vaccine is very safe. It's probably being monitored in one of the most intensive safety monitoring enterprises in US history, honestly. There have been no major side effects from the Pfizer vaccine that have been found. Most people get a sore arm, maybe some fever, headaches, muscle pains, joint pains, things like that. A few kids have gotten some enlarged lymph nodes, usually in the armpit. They tend to go away over time. But again, there have been no serious adverse effects. The Pfizer vaccine, no clots, no serious allergic reaction. So there's a lot of misinformation out there. The vaccine will not make you magnetic, no matter what they say on TikTok. It doesn't affect puberty or fertility at all. There's just no way it could do that. Vaccines really get in there and do their thing quickly and get out. The mRNA in the Pfizer vaccine degrades after a few days, so it's not there to stick around to cause an effect down the road or any long-term effects. And most vaccines do that. The effect is long-term because it stimulates your immune system, but the immune system is actually the thing that carries on. It's not the vaccine itself. So basically this is a bad disease, but we have this phenomenal vaccine. So I'd encourage everyone to come in and at least have a conversation about it. I'm happy to talk to parents. I'm happy to talk to the teenagers themselves. And I think if you are a parent, talk to your kid. He or she may have some surprising ideas. They think for themselves, they know themselves. How they think about this vaccine may be different than you'd expect. And so just ask, have that conversation. We can get back to seeing each other's faces, to hanging out around each other without worrying about masks and worrying about distancing, and get back to our lives.